Good afternoon, everyone. Thank you for joining the Scleroderma Foundation Rocky Mountain Chapter's Virtual University. This session is titled Overcoming Nutrition Challenges with Dr. Frech, and my name is Andrew Parr, and I am the board president of the Rocky Mountain Chapter. The Scleroderma Foundation in no way endorses any clinical trials, treatments, or studies mentioned in this session because the manifestations and severity of scleroderma vary among individuals. Personalized medical management is essential. Therefore, it is strongly recommended that it's now my pleasure to introduce Dr. Frech, and Dr. Frech has a research and clinical interest in systemic sclerosis. Her primary interest is early diagnosis and health care delivery to this patient population. She is most interested in the vasculopathy aspect of systemic sclerosis, since vasculopathy precedes fibrosis, and early intervention may improve outcomes. She has a strong translational science interest in defining the mechanism of vascular leak and inflammation. As the director of rheumatology clinical trials at the University of Utah, director of the University of Utah Scleroderma Clinic, and the principal investigator of the prospective registry for early systemic sclerosis in the United States, she has helped develop standardized data collection methods, both physical exam and laboratory, for patients with this rare disease. Thank you for joining us, Dr. Frech. I will turn it over to you now.
Thank you so much for the kind introduction, and I'm thrilled to be here today to talk about nutrition. Hopefully everybody's had a chance to get something to eat, and so that will come up during our talk. So you may ask the question, sort of why does nutrition matter? And the really most important aspect of having a chronic disease is realizing that nutrients are really critical for your healing tissues. And so when we talk about the gastrointestinal tract, it's important to realize we're talking about from the esophagus, stomach, small and large bowel, all the way from rectum into anus. And so all the immune cells that live along the GI tract constitute the largest immune compartment of the human body. So we really would like to pay attention to the gut and how it interacts with nutrients on a regular basis. So the major function of the intestinal immune cells is to monitor the gastrointestinal tract and make sure that that tissue is healed properly. It also ensures that you're delivering the proper amount of nutrients to the tissues so that healing can take place. So for that, I'll ask my first question. If everybody could fill out the poll, would you consider the meal or food that you're eating right now healthy? And so that would be yes, no, I cannot eat right now because I feel sick. I really don't know what a healthy meal is.
All right, the votes are being tabulated. So far, 77% say yes, 23% say no, and no one has selected C or D yet.
Okay. So I think we'll end the polling here. I'm glad to hear that everyone knows what a healthy meal is, because that really does attest to the importance of understanding and gaining knowledge on how to stay well. And so, there we go. So every time we talk about systemic sclerosis, I know for this audience, we often are well-versed in the classification criteria, how a doctor makes a diagnosis of systemic sclerosis. But I really like to show it as a Venn diagram to really point out that there are a lot of vascular manifestations of disease. And why that's so important is that the small vessel vasculopathy that we see, which is the Raynaud's is the earliest symptom, then results in this dysregulation of immune cells, and then a lot of fibrosis in skin and visceral organs, which means inside organs like lung and GI tract. And this occurs at different rates in different patients. And I really think this is an important concept because oftentimes there's many different things that go into a gut not feeling well. So if we think of a blood vessel that serves the lining of the gut, there are constant insults that the blood vessels have, and that can be changes in blood pressure, blood flow. In the same way you have renodes in your fingers, you can have renodes in your gut tissue. And additionally, there can be biochemical changes that constantly insult or interact with the endothelium. And the reason that is important is because the blood vessel is going to respond if it's constantly getting insults with either inflammation, oxidative stress, or an immune response that causes further blood vessel dysfunction. So when we think about scleroderma as this natural history of progression from blood vessels, immune cells not working very well that result in fibrosis, we can really see the importance of taking control of anything we can to improve that gut status. And so that's shown maybe best by the nutritional changes in diet that have occurred over time. So you think about, sort of the genetics of our guts. Over the years, we've changed our diet significantly. And it really highlights that our modern intake of sodium, decrease in potassium, as well as decrease in fiber, really is something that we can modify or improve that can improve the function of the blood vessels that line the gut. And so nutrition is an incredibly important insult to your tissues that we can focus on. And so, the importance of nutrition, of course, is that it maintains this well-balanced immune system. And so when things are imbalanced, the cells that line the gut are called epithelial cells, and they make up most of the cell lining of your esophagus and your small and large bowel. If something insults or hurts this epithelial cells, you have killer T cells that come in and they send out the stress molecule, and this gets all the other immune cells sending cellular signals to get the immune system revved up. And with that revved up immune system then will bring in other cells like macrophages to help clean up the damage that's been done. And then the B cells then make autoantibodies to kind of help prevent the same process from occurring down the road. Now, by way of example, let's talk about gluten. So a lot of people have been tested for celiac probably in the course of their illness. And some people will say, well, I didn't test positive for celiac with this TTG autoantibody, but I really feel that gluten makes me feel sick. So let's explain why that would be. So here we have the cells we just talked about. We have these epithelial lining cells that communicate with whatever's going into the gut. And so if gluten is seen by an epithelial cell in someone who's sensitive to gluten, the zonulin then tells the cells to dissociate, and that gluten gets across this very tight junction where it's not supposed to be. And the immune system modifies it, sees that, presents it to those immune cells, and then those immune cells send out more signals that are chemokines and cytokines that damage the cell. And then furthermore, they tell those B cells to make autoantibodies against the TTG in gluten, so that in the future, you're able to fight off that gluten. And so what happens, of course, is that causes this damage to the cells, and the gut doesn't work very well. And this immune event can occur immediately. If they eat gluten, they can feel really sick, but it really has these long-term consequences that can occur. Now, again, if you're gluten sensitive, you don't have these antibodies against TTG, but you may have this primary event. And so if you've been tested and you've been told, oh, well, I don't have celiac disease, but you still notice that gluten makes you feel sick, for this reason, it's important to avoid gluten in your diet. So what is a balanced diet? And it sounds like the majority of our population knows, but usually when we think about calories, we're talking about proteins, carbohydrates, and fats. It's important to realize that also a balanced diet includes minerals, vitamins, and water. And we're going to talk about each of these. The really hard thing for our patients, I think, that are trying to lose weight is that calorie counts can be really imprecise. And so as you would expect, a gram of fat has the most calories, and majority of those are absorbed. Protein comes in second with a lot of calories, but a lot of those calories are not absorbed. And then 1 gram of carbohydrates has about 4.1 calories, and with the majority of these, of course, absorbed. Take-home message is we're not absorbing all the calories that we consume. And this is particularly important for people who have a sick gut. So that's why I like to show that example of gluten sensitivity, because a sick gut is not going to absorb calories as well. And so if you've been really challenged by trying to gain weight, it may be the type of calories that you're consuming. Of course, there's another important thing to realize. Food companies can use any of these 5 different methods to estimate calories. And so there can be inaccuracies up to about 20% when you're trying to read your labels. This is important if you're trying to lose weight. If you're choosing a product that has 130 rather than 180 calories, it could be actually the exact same product. So there's variability in that reporting. Another important point is that when we cook our foods, we generally make the calories more available for absorption. And so by way of example here, there's an egg, steak, and potato, and you can see that while the product label may give you 1 calorie, once you cook it, you increase the caloric intake. And if you chop and blend your foods, that can also increase calories absorbed. And so again, calorie counting is not perfect. Furthermore, what is really very interesting is that each of our guts have gut bacteria that lines the gut. And what this bacteria does is it can affect how many calories you are absorbing. And that's why some people who go on probiotics find that they lose weight, and other people who go on probiotics say that they have gained weight. And what's very interesting usually is the people who are gaining weight are underweight, and so they're putting good bacteria in their gut, and so they're able to absorb more healthier nutrients. Whereas people who are overweight sometimes will lose weight by going on a probiotic because they're replacing that bad bacteria that's tending to hold on to more calories with good bacteria. So what is the role of bacteria in the gut? I actually had shown this slide to children, so that's why the jorts are on there. So the important thing to realize when you're kind of choosing your probiotics, it does vary by where that bacteria lives. So you can see here that our mouth bacteria is very different than that in the duodenum, stomach, ileum, and colon. And that's why there's no kind of perfect probiotic to recommend to a patient. And oftentimes we talk about really using your symptoms to advise which probiotic is best for you. But nonetheless, nutrition can change the gut bacteria and influence that gut barrier. So even if you don't have the right mix of bacteria in your gut, nutrition can really improve the function and barrier function. Also, on the flip side, bad bacteria can alter your intestinal immunity, and there's been shown that while gut biofilms do change, it has not been well characterized with medication. So we did a lot of work trying to understand what is immunosuppression due to the gut bacteria. And the reason this is so challenging is in big patient populations, the right bacteria for people probably are determined by sex and ethnicity and race and genetics in the background. And so this is a really very difficult thing to study. So let's pause there for our next question. And it is, I believe probiotics have helped my gastrointestinal tract symptoms. So yes, no, you don't know what a probiotic is, or you've never tried a probiotic.
And the results are coming in, and we're about a third of our participants say yes, about 16% say no, and 50% have never tried a probiotic.
Well, I'm glad everyone didn't say yes, because then I would feel bad about the next couple slides. So let's talk about probiotics. And for those who have tried one, I also hope that you get some information to help you kind of move forward if you've been unresponsive. And so let me go here. Sorry, it takes me a second for my computer to wake up after that poll. So again, what's the objective of probiotic is influence bacteria in the gut. So we always go back to, we want to keep the cells that line the gut healthy, and we want to keep, while we do need our immune cells patrolling the body and cleaning up when there's inflammation, we want to keep that in balance. And so this concept of a probiotic are that they're live microorganisms that have been administered in adequate amounts, have shown potential benefits in systemic sclerosis patients. And actually, we did the study here at the University of Utah, and it's a very small study if you read it. But the reason I published it in a small numbers of patients is I was so impressed of its ability to improve bloating and abdominal pain and distension in patients. I wanted to get that information out to other providers because I think it's a really important concept. A lot of people ask about a prebiotic. So prebiotics are non-absorbable carbohydrate polymers that you're not actually putting bacteria in your gut. Instead, you're putting in polymers that promote the metabolic activity expansion of beneficial gut bacteria. So some people will say, you know what, I feel a little bit better if I take a prebiotic, just something that kind of gets my good bacteria revved up. A probiotic in our study, we looked at a line which is Bifidobacterium. If you remember back to our Dortz picture, that's in the small bowel. That probiotic worked very well for our patients, but we don't endorse it because it doesn't work for all patients. And so again, that take-home message is you go to the pharmacy, you can ask the pharmacist for help to pick out a probiotic. You can then try that probiotic for 4 weeks to see if it helps your symptoms. If it doesn't, you should stop it. Probiotics and prebiotics are not something that you should power through or suffer with and think, well, I've got to get that good bacteria growing. It really, your body is telling you whether it likes it or not almost immediately. And then antibiotics is another important concept. These, of course, are what we use if there's a digital ulcer that's infected, or if there's bacterial overgrowth, you may be given an antibiotic to get rid of the bad bacteria. But it's really important to realize if you've been on an antibiotic, that can have a positive or negative effect on you. So let me just show you. If you had a urinary tract infection and your doctor treated you with doxycycline and you noticed your gut felt a lot better, that's a clue that you may have small bacterial overgrowth. Alternatively, if you go on an antibiotic for a digital ulcer, and you have a lot of diarrhea and your GI tract symptoms really seem to get out of control, it could be that just starting with a probiotic is the next best step. That can help repopulate that gut lining tissue. Alternatively, you could also consider being tested for C. difficile, which would mean that you had now acquired an infection because the antibiotic killed off the good guys in your gut. So what can you do for healthy eating? And so I like this to show you that a lot of us are very well versed in sort of taking multivitamins. I really like Centrum Silver or prenatal vitamins, and I probably, if you've seen me in clinic, I've told you this, I like generic versions of vitamins. The name brand ones are no better than generic, so you can save a little bit money. But really what you want to do is kind of understand what is your goal with taking that multivitamin? And the one that has the most data in systemic sclerosis is vitamin D. And that is something that if you have not had your vitamin D level tested by your physician, is a good thing to ask about. So vitamin D comes from the sunlight as well as ingestion. What happens is you get this vitamin D once it's in the liver. The liver makes it 25 hydroxylase vitamin D, and that's usually what the lab will check. It then goes to the kidney, and the kidney puts a 1 on top of that 25, and it makes it the biologically active form. The synthesis of vitamin D then facilitates absorption of calcium from the small intestine, from the kidneys, and allows you to really keep your bone health at goal. So it's a really important molecule for your bone health, but more importantly, there's also been a lot of research, and this started actually in the lupus community, is they realized that there are these vitamin D receptors on immune cells, and that the vitamin D receptors are in skeletal muscle as well as vascular cells, and that if you replaced vitamin D in patients that were vitamin D insufficient, patients felt significantly better, both from an energy standpoint as well as a musculoskeletal standpoint. And it has been noted that in systemic sclerosis, fibrosis, patients with pulmonary and cardiac involvement tend to have lower vitamin D levels. So it's an important thing for you to ask your physician about. But what your doctor may say is, rather than taking a lot of supplements, really can you get there with nutrition? And so trying to understand what food types give you your fat soluble vitamins is really important. And again, this really attests that there's no magic diet for systemic sclerosis or chronic illness, but healthy foods really are important for each patient to be aware of and what that's doing for your health. So if you have a lot of muscle aches, you might find that flaxseed is something that is good for you to add to your meals. Additionally, asparagus. So what are dietary minerals? These are inorganic nutrients that are present in really minute fractions in foods and have functional and structural roles in the body. And this gets pretty difficult because there's both macro and micronutrients that are minerals. So your major elements usually will show up in the routine basic metabolic profile that you're getting from your doctor. And we talked a little bit about there's lots of issues that we really need to control our sodium because genetically we were never supposed to see this much sodium. And so really keeping an eye on your sodium is good for all patients. Similarly with potassium, bananas, orange juice, things that have natural potassium in it is the best way to get your potassium. But what gets tricky are these trace elements. And so while your doctor may check iron quite frequently if you have an anemia, it's not very standard for zinc and copper and selenium and magnesium and cobalt to be checked. And the reason for that is trace element replacement is really very difficult because really you require really minimal amounts that are present in a multivitamin. So most folks will say, well, if you're taking a multivitamin, then you should be getting everything you need for micro trace minerals, and there can be a lot of danger in over supplementing these. So you really want to be careful in how you're doing this. There is some recent data on sort of trying to understand if people are not able to absorb trace elements, how can we do a better job? And I'll speak to that in another slide. So water is another common question that patients come up with. This is 70% of your body. It has no caloric value. So this is particularly helpful for people who are trying to combat overeating. Remember that a lot of people with ulcer disease will kind of constantly feel hungry. And so sometimes eating makes the stomach feel better. And so it's really hard for patients because they feel like they're between a rock and a hard place. If their stomach hurts and eating makes them feel better, but then it causes weight gain, how do they deal with that? And so sometimes increasing your water intake can help with that. Now, I get a lot of questions on alkaline water, and it is really important to realize this has not been extensively studied because the proper study design has not been there. When we use the term alkaline, we're talking about the pH. So alkaline water runs usually in this 8.8 range. And the reason it became really interesting to scleroderma patients is because alkaline water affects pepsin. And so it was thought in 2012, this could be a way to combat reflux disease. And so a lot of patients asked, should I be drinking alkaline water? And the research just is not there. So again, we don't know if it's safe. We don't know what it does to bone health and nutrient absorption. But I do point out the one thing that did come out is that when most bottled water uses this reverse osmosis, so theoretically that bottled water could be making your reflux worse. And so that kind of acidic water by the contra thinking of alkaline water is something to pay attention to. And so if you've noticed that when you drink bottled water, your reflux gets worse, it may be important just to move to tap water with a filter. So what about dietary supplements? So when we talk about a well-balanced diet, again, you're going to think about your fruits, vegetable, grains, and protein, and then, of course, dairy. If you are lactose intolerant, then Lactaid can be used, or the more important thing is what I really recommend is meeting with a dietitian to really make sure, again, you're getting adequate dietary supplements for what you can't tolerate. But if you're going to actually take a supplement, that is something that is usually thought to be the vitamins, minerals, fiber, fatty acids, or amino acids. And the best fact sheet that I can find is from the NIH, and it kind of helps you kind of go through, do you need to do, or should you be thinking about taking a supplement, and what are the safe ways to do that? But there's caution, of course, because supplements feel safe. They feel like, okay, these are available over the counter. But the really important thing to realize, particularly for any of our patients that have participated in a clinical trial, when something goes to clinical trial, there is such oversight and regulation, and patients' blood is looked at how they're tolerating the drug and what potential side effects are occurring. So a supplement doesn't require any of that work, and so it's thought to be sort of a food product. But a lot of them are more like drugs, and should be studied with more vigor before we feel comfortable taking them. And it's actually the responsibility of the dietary supplement manufacturer to ensure their products are safe and that their label claims are accurate and truthful. And actually, it's only if something's found to be unsafe once it's on the market can there be an action to take it off of the market. And so just real caution in taking supplements that feel safe but potentially haven't been studied. Now, the one thing that is really important to kind of back up at first and think, if you're worried about your nutrition, think, is it because you're on medications that are causing your appetite to fluctuate? And a lot of the medications, immunosuppressants, can make your taste change. And so if that's, or make you feel kind of not hungry, if that's really important for you to keep a calendar of when you feel hungry. Also be aware of any food or drug interactions. Usually the pharmacists at any pharmacy are willing to talk to you about this. And then just also be aware, do you have the ability to comply with dietary lifestyle changes? And why that's really important is, if you're a young mother with young children and you're making a lot of mac and cheese and spaghetti for your children, really it is important that if the food you're serving your young children make you feel sick, kind of starting to cook 2 separate meals becomes really important. And there's always this expert consultation with a registered dietitian that's recommended in pediatric patients before any dietary changes are made. So actually, I was a pediatrician before becoming a rheumatologist, and that's a really important concept of not making changes in children before you get good advice. And so I think that's important for adults as well. But I'll tell you that the most common thing we recommend is at least a trial of the FODMAP diet. And so if you haven't seen the FODMAP, if you come to clinic, we do actually have this recommended in our new patient packet. It's something to at least try for 6 weeks. And this stands for trying to get molecules that really make irritable bowel worse addressed. So these are short chain carbohydrates that are poorly absorbed. They take in a lot of water with them. The bad bacteria kind of ferment this, and it can cause symptoms of abdominal pain and bloating. And the important thing to realize, the FODMAP diet is not right for everyone because it can affect the microbiome, and that just has not been long-term studied. But there's phone apps you can use, and there's a way you can try to eliminate these different food types that could be causing your abdominal pain and bloating for 6 to 8 weeks. And then after 8 weeks, you start introducing different foods. And what most patients that do this, they are able to identify certain foods or drinks that really just cause them GI tract symptoms. But it's important to realize, if there are foods you are unable to introduce, then really going to a dietary education session by a trained dietitian is really very important, because what you don't want to do is get a micronutrient deficiency because you've eliminated a sort of type of food. And so a dietitian can really help you navigate that. And so that's our last poll question. Is a registered dietitian has helped me improve my nutrition? Yes, no. I've never met with a registered dietitian, but be interested in seeing one. Or I do not need to see a registered dietitian.
All right, so about a third have said yes. About a little less than 25% have said no. 43% have said they've never met with a registered dietitian but would be interested. And 6% of our participants said, I do not need a registered dietitian.
Fantastic. Well, then again, I'm really glad that we've done this polling, because it really helps me make sure, of course, that we're providing information that's of value. And so, oh, I think I do this. So perfect. And so we'll talk just now a little bit on a dietitian. I'm sorry, as you know, it pauses there for a second. Okay, so what is a registered dietitian? So this is an expert in human nutrition and regulation of the diet. And the real take-home message here is the dietitian should alter your nutrition based on your individual needs. And this is why the FODMAP's a great place to start for a rheumatologist. But after that, really having someone go through your dietary needs and your particular foods that bother you can be incredibly valuable. So these are regulated healthcare professions. They are licensed to provide nutritional advice. There was a speaker that I had come to the national meeting a couple of years ago, Maren Kinney, who's the registered dietitian I use. I know personally she has helped many of my patients, and she has just been a real wizard with sort of understanding how to help patients combat different food restrictions that they're having to follow. And just realize that you may have a registered dietitian that's specific to you. If you are interested in sports nutrition, so you're very active and you want to stay active and you're wanting to know how to supplement what you're eating to keep active, that's a sports nutritionist. Of course, there's pediatrics and then food allergy nutrition. And the important thing to realize is most insurance plans will cover up to 10 visits a year, and it just requires a prior authorization. So this is maybe where you've hit a wall before, is you've tried to see one and you've been told it's not going to be covered. The way we usually will do this is the dietitian is usually in conjunction to a gastroenterology clinic. So you can see the day you meet with your gastroenterologist, the dietitian can meet with you as well. And so that's one way to kind of bypass the restrictions. But I think it's really important to realize these are different populations across the world. And ours, of course, our population was super, super small. But out of 24 patients, 25% of our patients, when we just had them filled out a nutrition questionnaire, we found were at risk for malnutrition. And that's really important conceptually. So even if you feel like, no, I'm doing okay, you know, I probably am not malnourished, it was fascinating to us to find that actually there was evidence of malnutrition. And those patients were not a specific weight, a specific age, or had a specific type of scleroderma. So it's really, you know, something your nutrition is important. I'm going to touch very briefly, I'm going to check my time here, but very briefly I'm going to chat and talk about meeting nutritional needs, because I think this is a concept that a lot of patients get nervous about. When we talk about if they've lost a lot of weight, they may have a refractory digital ulcer or something that's not healing. And so we'll say, well, maybe we need to get your nutrition up. What a nutritionist will do at first is talk to you about how to get your nutrition up by mouth. Then they may say, well, we should do a brief period of a nasogastric tube. And what this usually brief period, 1 to 2 weeks, will help to see if you tolerate food tube feed, excuse me. And then they can either put a tube into the stomach with a extension that goes either into the jejunum or directly into the jejunum. So these feeding tubes, and I've had patients very briefly, they may need this for 3 months to get nutrition up. They start to feel better, the tube comes out. Peripheral nutrition, or TPN, is something that is usually reserved sort of for really kind of end-stage nutritional needs, and this is getting your food through your vein. And of course, the issue here is if your gut is not seeing the nutrition, it's just going right into your vein, then the bad bacteria can really overgrow, and that can cause a lot of residual gut problems. So these are sort of really reserved for sort of special cases. But I will point out that the reason, if you're going to just talk about doing a supplementation, this is done most definitely with a nutritionist, because there's different indications and different types of feeds that can help our patients feel better. One of the ones we would commonly recommend is the one that has L-arginine, this one here from Abbott Nutrition, because we do believe that L-arginine helps endothelial cells work better. So again, lots of different options for getting your calories up. But an important point is that that's not something that comes without risk, or comes without having us work very, very closely either with home health or nutrition to do this. And again, there are several different aspects to if the tube gets occluded or how to keep your nutrition up. And so I'm not going to go through this, but I want to again really highlight that if you've thought like there's nothing left for nutrition, there's always options. Very briefly, I'll conclude with allergy testing because this is a big question that we get. The role of food allergy in systemic sclerosis is unclear. Back to our picture, this would be if there's that insult comes, there's these mast cells that live alongside the mucous membrane. And what happens is mast cells release histamine and cytokines and cause that kind of immediate reaction. And so oftentimes people have a really hard time knowing whether what foods are triggering their symptoms. There can be extensive allergen testing provided, and that can either be done by skin prick, patch testing, and what we most commonly do is just a blood test that looks for extensive allergens. I have to say, I do send a lot of these. I don't find a lot of positive results, but when they are positive, it's incredibly helpful. I have found patients that are allergic to low levels of peanuts and they had no idea, or almonds, and they take that out because they were trying to eat healthy, and they actually get a lot of their symptoms resolved. And again, back to that our goal, of course, is just restoring gut balance and trying to figure out how to take foods out properly. So I told you last slide before, but this is the very last slide. The one of the things people ask, we don't use a lot of steroids in systemic sclerosis, you know that, because of the risk of renal crisis. But every time you're on steroid, you want to make sure you're talking with your provider. Why are you on it, and are you on the dose that could be reduced? Again, this glass of water before a meal or snack can help you with the food cravings. And then there's a really nice chart here that kind of talks about if you're craving chocolate, then your body may be wanting magnesium. So nuts, seeds, veggies, and fruits may kind of cut that food craving down. And that same thing with bread, pasta, high protein foods can help with that. And again, this all, of course, needs to be individualized for your diet and your restrictions, particularly with salty foods. As we talked about, we really want to watch our sodium intake. Also, make sure if you are on steroids mandatorily, you're adding exercise to your daily routine. So with that, we're going to have time for discussion here. I hope I've convinced you that malnutrition is really important consideration, and eating well is essential for your health. It really can help you understand your dietary needs and healing, because that is a very critical aspect to your wellness. A registered dietitian can individualize your nutrition plan and is a service that is available, and I think is particularly helpful for navigating individual restrictions and needs. And then, of course, if you're on steroids, just make sure you're exercising, you're drinking more water, and you're always asking about getting off of those. And so I always acknowledge all the lovely, wonderful patients and their families that have helped me understand how to take better care of them. I have a care team, a science team, and funding that helps me do my work. But most importantly, the Scleroderma Foundation. I just give a huge shout out to the Rocky Mountain chapter. You guys are amazing and do such good work for patients. And I'm very appreciative for you taking the Salt Lake crew under your arms. So with that, let's get to the questions. And I think, Andrew, are you moderating and going to ask me the questions, or do you want me to pull down the chat here?
Yes, I would be happy to ask you. Perfect. And Dr. Frech, thank you so much for your presentation. This has been fantastic, and we've got about 5 or so minutes. So I just want to remind everybody, let's use the chat. And if you put your cursor over the screen again, you can see the chat function. And we do have our first question. What foods or vitamins help for leg and foot muscle cramps?
Such a good question. I'm glad you asked that. And this is a real challenge. So the reason that's a great question is you get Raynaud's to your feet, and that can sometimes be vasospasm. And that cramp really is kind of coming more from the muscle. And so we do believe coenzyme Q can be incredibly helpful. I talked a little bit about L-arginine. The tricky thing with L-arginine is it is a supplement. It was studied. It didn't show the outcome that people wanted. But again, getting back to individual patients, I do have patients report back to me that coenzyme Q, and that's again available over the counter, and L-arginine also available from a health food store, are supplements that have helped that cramping. However, if you really notice that your foot is cold or is really pale, it's like sustained cramping, we always do worry about what's called critical ischemia. And so in that case, if the blood flow wasn't getting to your foot, then a vasodilator like your calcium channel blocker may help. And more importantly, if you have that sustained kind of cold foot, we'd want to do a vascular study to understand if you need to have an intervention to get better blood flow. So to back up, mild cramping, coenzyme Q, L-arginine, kind of severe cramping, that seems vascular related, calcium channel blockers, your vasodilators, sustained kind of severe cramping, interventional studies to kind of understand it better.
Awesome. Do we have any other questions out there? Yes, here we go. Does juice plus fruit and vegetable caplets help supplementation?
So that is also great questions. So this is another fantastic question. The truth of the matter is, if you can't get it naturally, then it's better than nothing. But that's got back to this sort of concept of if you're blending things, you're supposed to absorb more. But what it happens really, if you're just doing the tablets, is the fiber benefits are going away. And so we really prefer if you could make a smoothie and get the benefits of the natural sources without just a tablet. That's definitely better. If you can't, if volume's really an issue and you just can't get volume in, then a tablet can be important. I'll point out another thing. If you've noticed that fiber, like you're trying to get a lot of fiber in your diet and that is making you feel incredibly sick, you could have what's called gastroparesis, and that's your body saying, I can't move this fiber. And so we oftentimes actually take fiber out of people who have a lot of gastroparesis, and in those cases, those pills can be, or supplements can be helpful, but if those are the patients I really would send to Marin, because what she'll do is she'll look to see, cobalt or magnesium. She'll really look at the micronutrients and make sure that everything is being accounted for. But great question.
All right, our next question is, if my acid reflux is triggered by water, what other options do I have besides water?
Such a good question. So first thing, that's why I brought that bottled water out. You can see if tap water makes you feel better. And if you're like, well, I'm worried that there's contaminants in my tap water, just pumping, going through, your pump and not doing the bottled waters can sometimes help. So that's the first thing. And then you can try the alkaline water to see if that kind of helps resolve. And again, I always point out, this has just not been studied extensively, but that really is thought to decrease the pepsin. And I've had a lot of patients tell me back that alkaline water really helps me. Outside of that, if you're, sometimes people will say milk is more coating. So if you don't have a dairy intolerance, patients will find that sort of milk can kind of help soothe their kind of reflux symptoms. And then one thing I would advise against is anything carbonated. So carbonation can really exacerbate reflux at the lower esophageal sphincter. So just make sure you're not drinking carbonated, like sparkling water or carbonated water.
All right, and then looks like depending upon your answer, we've got time for one more question, and the next question in order is, can you elaborate a bit on probiotics and what to look for?
Fantastic. So I'll try to answer this quick so we have room for one more question. So for a probiotic, I usually will start with Bifidobacterium, that's Align. And I'll just have patients go and say, I want the generic of Align to the pharmacist and start there. Because most people have like a small bowel issue. So start there. If that causes bloating, distension not to go away, you can try a different brand, but it really is trial and error. And so that's actually why I love patient forums, is people can say, oh, this one really worked for me or did not. So getting, again, trial and error, stick with it. If you're immediately having symptoms, stop it. If it's making you feel better, stick with it. I do think rotating probiotics sometimes can help people if they feel like the probiotic has lost efficacy.
And then we have two separate questions about FODMAP diets. Can using a FODMAP diet help delay gastrointestinal problems? And are any of your charts regarding the diet and food cravings available?
Yeah, so you can have all these slides. Those are completely available to you. It's in, especially the food craving one. I like that one. But as far as the FODMAP, this is the thing. If it takes away your symptoms, it gets called irritable bowel, and I kind of don't like that label. But if it takes away bloating and distension, and absolutely, then I would say it's prevented problems. And that's in a large proportion of our population. The real important thing is start reintroducing foods and just identify what you can't tolerate. But it's a great place to start. And I will tell you, in our practice, I feel like we've had really good GI tract outcomes because we start that on every patient first visit just to see if it helps them. And then every patient kind of navigates what they can tolerate from that.
Awesome. Dr. Frech, thank you so much for sharing your time with us today. And to all of our active participants, thank you so much for making this a great session. And we would like to thank you for joining us today. And also a special thanks to our Diamond National sponsors, Actelion Pharmaceuticals and Boehringer Ingelheim. Dr. Frech, thank you so much.
Thank you so much. My pleasure. Be well, everyone.